The NHS does an amazing job, but it's also got many challenges. We think that digital and data is more than an enabler of care, but it's critical for the transformation of services, the improved patient experience, and to try and solve some of these problems. Almost every interaction with health and care leaves a digital trace, whether it's diagnosis, treatments, tests, or outcomes. But because care occurs in many different locations, and because data is siloed in many different applications, it's difficult to join data up to answer some of the basic questions. We don't have enough IT resources to build the same infrastructure in every one of our organisations. We need to build single data platforms once for our region.
Healthcare data is inherently complex, is captured across multiple clinical systems and clinical pathways. To derive value out of healthcare data, it's important that we're working off a single semantic layer or a common data model. The OMOP data model has been battle tested by a global community, and Lancashire teaching hospitals have already confirmed our data into the OMOP common data model. We work with siloed data sets, and it takes significant effort and repeated effort within small under-resourced teams to extract value out of these systems. The Secure Data Environment Program addresses these challenges by adopting a single lakehouse architecture for the entire region that connects up all these providers and allows teams to work within a single semantic data layer, allowing us to accelerate the development of intelligence and translating data and intelligence into public benefit. We've been fortunate to have found Telefónica Tech, who we've been working with over the past 8 months to deliver this at an accelerated pace.
It's not a small project setting up a secure data environment, a new data environment like this from the beginning. We've got multiple different organisations that are providing data. We've got multiple different data sources and types of data that we're working with. So we had to split the project into phases so that we were able to deliver it smoothly and fast. We also knew that we wouldn't be able to deliver this on our own, which is why we've partnered with Telefónica Tech, who have got a wealth of skills and knowledge that we were able to lean on.
We care deeply about your privacy and confidentiality. To ensure this, we're implementing the 5 Safes framework. This provides multiple layers of security that include how people use the data and how the technologies protect it. I'm not only keen to bring the public closer to the NHS and the team leading the research infrastructure piece, but also working closely with external providers like Telefónica Tech, who have demonstrated a real keen desire to work more closely with people like myself, not just the technical team, but also those who are involved in the ethics and public outreach aspect of the programme itself.
I'm really excited for the future of Lancashire and South Cumbria, and particularly as their team becomes more empowered through the embedded team approach we're taking together, and as the platform is enhanced with additional data sets. Through our work together, we've learned a lot and have developed a repeatable model and a set of best practices that can be rolled out across regions of the NHS to help them deliver their secure data environments and tackle their data challenges.